Good afternoon, everyone, and the topic of today's lecture is cholinergic agonists. And cholinergic agonists are acting on the autonomic nervous system, and the places where the cholinergic receptors are located are the ganglia of the sympathetic and parasympathetic nervous system, and also the muscles that are innervated by the parasympathetic nervous system. Those are the smooth muscles. So the preganglionic receptor in the and the nicotinic receptor in the ganglia, and also the postganglionic neuron is also acetylcholine with the also with the cholinergic receptor. So the only difference is that in ganglia the receptor is nicotinic subtype, and in the smooth muscles of the parasympathetic nervous system, postganglionic receptor is a muscarinic. There is also a adrenal medulla that has also nicotinic receptor, and the neurotransmitter is acetylcholine. So, and also in somatic nervous system, there is a nicotinic muscular receptor, and the neurotransmitter is also acetylcholine. So these are the places where the cholinergic drugs can potentially act. And the acetylcholine is synthesized in the nerve ending, in the acetylcholine nerve ending, and is stored in vesicles. So it can be released with the calcium entrance through the cell during the cell excitation. So the nerve impulse will travel to the end of the neuron, and that will lead to the opening of the calcium channels, and that will start the release of the neurotransmitter. And then acetylcholine will act on acetylcholine receptors. So this can be either muscarinic or nicotinic receptors, and then this action will be stopped by the destruction of the acetylcholine by acetylcholine esterase, a special enzyme that is released to the synaptic cleft, and then will act on the acetylcholine, and will destroy the neurotransmitter that will stop the activation of the receptor. So then, choline is taken back by the neuron and is used to synthesize acetylcholine again. So this is what happens with the acetylcholine. But those receptors, either on the presynaptic or the postsynaptic membrane, can also be activated by the other drugs that mimic the acetylcholine with the chemistry, and they can be selective to some subtypes of the receptors. So, for example, there are muscarinic receptors that were identified by the selectivity to the muscarine, that is a plant alkaloid, and then the acetylcholine is also activating this receptor, but the nicotine is the alkaloid of tobacco is not activating this receptor. So that is why this receptor are selective to muscarine. So, and vice versa, a nicotinic receptor will not be activated by the muscarine because it doesn't fit the receptor. So it can be activated by the acetylcholine because acetylcholine is a universal neurotransmitter, so it will activate both muscarinic and nicotinic receptors. And nicotine will activate only nicotinic receptors, will not activate the muscarinic receptors. So this is the selectivity of the drugs for the cholinergic receptors. So the higher is the affinity to the receptor, so the drug will bind to the receptor. The low affinity will not bind, and that is why there is a selectivity to this or that subtype of the receptor. And drugs that act on cholinergic receptor can be divided into two types, so direct acting and indirect acting. So direct acting drugs are binded to the receptor and activating the receptor as the neurotransmitter acetylcholine. Indirect acting drugs are not binding to the receptor, but instead they inhibit the acetylcholine esterase that destroys acetylcholine released from the presynaptic cleft, from the presynaptic neural membrane, uh, sorry, from the presynaptic nerve ending onto the synaptic cleft, and this way the receptor will be activated by the acetylcholine. So actually indirect acting drugs will have the same selectivity as acetylcholine, so they're not selective, so that they will activate all types of receptors. And they are also divided to reversible and irreversible depending on the uh, type of the binding to the enzyme. So reversible can be after discontinuation the effect will be gone, but with the irreversible the effect will be stable even after discontinuation, and some of the irreversible drugs will be the warfare agents. And there is also a uh, the for the treatment of the uh, uh, intoxication or overdose, the pralidoxime can be used for the treatment of the overdose of the indirect or acting or, or reversible drugs, so or anticholinesterase drugs. So the direct acting drugs include the acetylcholine itself is not used as a drug. Then bethanicol is uh, the bethanicol is like acetylcholine is actually this uh, formula is this, and it is an ester and is easily destroyed by the acetylcholine esterase, because this esteric bone is easily cleaved, and then the acetylcholine is not active anymore. That is why the chemical modification lead to the synthesis of bethanicol, that is a amide derivative of the acetylcholine with the methyl group at the position beta. So here the uh, uh, carbamic acid ester is resisting to the hydrolysis by the enzymes including acetylcholine esterase, and that makes the bethanicol longer acting. And the same is with the carbachol, that is has almost the same chemical structure, and the duration of action is longer. Then there is also a pilocarpine that is also long acting, derived from the plant, and this is used in the ophthalmology only. Then the nicotine is an alkaloid of tobacco and is not used for that as a drug, but sometimes is used for the uh, dependence treatment of the dependence from the nicotine or smoking cessation treatment. So this nicotine patches or nicotine chewing gums can be used to uh, to help patients to quit smoking. Then carbachol and bethanechol and cevimeline are mostly used for the urinary bladder uh, stimulation, and pilocarpine is used for the treatment of the closed angle glaucoma in patients with the eye disease glaucoma that that increases the pressure in the eye, increased pressure in the eye. And the adverse effects of the uh, cholinergic agonists include diarrhea because they stimulate uh, the GI system, and also they stimulate the sweating, and meiosis is seen as the characteristics uh, uh, characteristic for the overdose, and the patients can be diagnosed by the meiosis, and then nausea in high doses, and urinary urgency also in high doses. So and urinary urgency is because of the stimulation of the bladder and the relaxation of the trigon sphincter. So because of these side effects, and also because the non-selectivity of the cholinergic agonist, they have a limited clinical application, and that is why they are not used commonly. So uh, and the next group are the non the indirect acting uh, drugs will not act on the receptor, so instead they will prevent the enzymatic uh, hydrolysis of the acetylcholine. So this drug will block the enzyme, and that will lead to the longer activation of the cholinergic receptor. So the drugs include neostigmine and physostigmine, and endorphinium and ehotiazide are used less commonly. So mostly neostigmine and physostigmine are commonly used. And the actions of the physostigmine include the contraction of the GI system, including the intestine and stomach, and also meiosis. So actually the effects are some effects are common with the cholinergic agonist. So meiosis is a universal diagnostic criteria for the overdose of the cholinergic agents. And also the hypertension may be seen because of the action on the smooth muscles and heart, and bradycardia is commonly seen because of the decrease in the heart contraction rate, and that also will lead to the hypotension. So these are the most common symptoms of the physostigmine action. So and uh, the other indirect acting drugs have the same action, but may have longer duration. For example, the ehotiazide and endorphinium duration of action is up to several weeks, and neostigmine, physostigmine usually lasts about half day. So that is it for today. Do you have any questions?
Yes, please, sir. I have question concerning a drug named succinylcholine.
Okay.
Uh, this about this drug, uh, I know that it causes depolarization in the neuromuscular junction. So why it isn't it is not like seen as an agonist, but we are putting it as an antagonist since it can cause increase in the depolarization. And if we have increase in the depolarization, then the contact will pass, the action potential will pass, and we will have a good contraction of the muscle. So I
Yes,
can't understand why.
yes, we will have a good contraction, but the the reason is that succinylcholine is blocking it irreversibly, and the contraction will not be followed by relaxation. So, and after, because skeletal muscles cannot contract uh, for a long time, eventually that the action of the succinylcholine will lead to the relaxation of the skeletal muscle. Because if we because skeletal muscles cannot contract uh, for a long time, like they usually should contract and then relax periodically, so to be able to keep the force of the contraction, like for example, if you lift some weight with the hand,
Mhm.
how long can you hold it?
Not for a short period of time.
Okay, for the shot. So, but if the drug will force you to hold it for several hours, then how do you think what will happen with this with the muscle?
It will be destroyed.
It will not be destroyed, but it will be tired, and that is why it will relax afterwards.
I think it's
Ah.
the refractory period, no?
Yes, quite right. It's refractory period, so it will not contract anymore because to contract you have to relax before contraction. So, and that is why the nerve ending always neuron is always firing, but there is no response from the muscle because muscle is overtired, overstimulated, and that is why first it will cause a high contraction, and that followed by this relaxation, and then actually, unless we remove the drug, it will be relaxed all the time.
So actually, this drug is we are searching the overdose, not the overdose, but like the extra effect of this drug to 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 take its benefits. Because for me, this drug should be an agonist, not an antagonist. That's how I'm seeing it. But like when we are using it, we are seeing the excessive the maximum effects, like it will contract the muscle, and then it will cause the paralysis of the muscle. And because finally it will cause this paralysis, it's considered as an antagonist. That's it.
No, it's considered antagonist because it will stop neuromuscular junction working correctly, because correct working is contraction relaxation. So like the nerve will fire, but there will be no response from the muscle, and like uh, the purpose of the neuromuscular junction is to to make the transfer of the excitation, like the and make muscle to respond. But because it's not responding, that is why it's blocking neuromuscular junction. The mechanism of blocking can be different, and yes, it will contract first, but eventually it will block it. So that is why it's blocking. But
Okay.
it's like there are two types of the blockers. There's depolarizating and non-depolarizating. So this is a depolarizating. blocker. So we will get to that like next week, I think.
Okay, thank you.
Any other questions? There are not so many drugs here actually, so that is why it's mostly theoretical, and you can just, so the indications are only for the stimulation of the bladder in the lazy bladder. So there is a disease called lazy bladder when patients are not urinating. So, and then that is can be seen sometimes in pregnant women after the delivery, and also after this abdominal surgery. So these are actually most common, and
I have
also used for the treatment of the eye. So like pilocarpine is very effective for uh, for the emergency treatment of the glaucoma, because it's effective both during the open angle and during closed angle glaucoma. Ashraf?
Yes, please. Another question about cholinergic agonists. First, in the beginning, we said that the autonomic nervous system is decomposed to parasympathetic and sympathetic, and somatic nervous system is another thing that is divided to sensory, and to motor. But when we are talking about cholinergic agonists, it should touch only sympathetic and parasympathetic. In other words, it should touch only the autonomic nervous system. So why are we talking about muscles who are belonging to the somatic nervous system?
They are also will work with the muscles, so because the cholinergic neurons are also located in the muscles as well. So, but the receptor is nicotinic, but still, for example, acetylcholine will stimulate these nicotinic receptors. So if we use the muscarinic, selective muscarinic agonist, it will not influence the muscles. But if we administer nicotinic agonist, it will also act on the nicotinic receptors, but unfortunately it is not used in the clinic, so there are actually no drugs that are used for that purpose. So, but theoretically, there are nicotinic muscular receptors that are cholinergic, and they will also be activated.
Okay, so unit two, unit two should be named not only drugs affecting the autonomic nervous system, but drugs affecting autonomic nervous system and somatic nervous system.
Uh, Yes, maybe that's true, but they mostly cover the autonomic nervous system, and also uh, like the most clinical importance in the autonomic nervous system. That's true. The actually this the correct name is drugs acting on peripheral nervous system.
Yeah,
So
yeah, yeah.
like that includes both somatic and autonomic nervous system. But most of them, like 90% of the drugs, are acting on autonomic nervous system, and it's like more diverse. There are sympathetic, parasympathetic. Every organ is innervated, and there are different actions on the heart, on the GI, on the smooth muscles like uterus, lungs. So, like most of the knowledge that we get is about the autonomic nervous system, and the muscles are actually used like the only clinical application for the neuromuscular junctions in the somatic nervous system is the relaxation of the muscles before the surgical operation. So that is the only application actually. So
Okay.
so there is
And
not
in the
much
case of
drugs in.
myasthenia gravis,
Sorry.
myasthenia gravis.
Yes, myasthenia gravis actually the disease that requires vice versa, so it will require stimulation of these muscles. So, but it's very rare disease actually. So I haven't seen it even once here in Kazan. So, and that is why drugs are usually these are not common drugs used.
Okay. Thank you very much.
You're welcome. Any other questions? So if no questions, then I think we can conclude. And for the so see you next week and have a good holiday. So I remind you that the March 8th will be a public holiday, so we will not have classes.
All right. Thank you. Have a nice day.
Bye bye.
Goodbye.
Have a nice day too.